Hi, I'm Dr. Parang Malikzadeh.
And I'm Dr. Parisa Malikzadeh.
And we are
Sisters RX.
Thank you for joining. Today we'll be discussing labor and delivery, and we have a very special guest with us, Lindsay. Tell us about your credentials a little bit.
Sure. So my name is Lindsay. I'm a labor and delivery nurse. I have a certification with my RNCOB. I've been doing labor and delivery for about 8 years now. Prior to that, I was in the ER as an ER nurse, but I made the transition up to labor and delivery, and I've been doing that ever since. I really enjoy the fact that there's aspects of ER to labor and delivery. You don't know what's going to come through the door. You can just have a basic labor patient, or you can have an emergency on your hands.
Totally.
So it's a lot of fun.
Last week, we were primarily discussing the different support individuals and groups that may help you with your labor and delivery journey. Today, we'll be discussing specifically the journey that you may experience during labor and delivery at a hospital.
What is labor? Can you clarify that?
The textbook definition of labor is going to be cervical change. There's 3 stages of labor. Stage 1, which consists of a latent phase and active phase. And basically, that's when the cervix is actually dilating, which is, you can think about that as the doorway. The door has to open completely for the baby to come down the birth canal. And so that's stage 1. Stage 2 is when the doorway has opened completely and the baby is entered the birth canal, but the baby has to come down the birth canal. And then once your kiddo's here, excellent. Not done yet though, because stage 3 is the placenta or the afterbirth.
Yeah, so how long does this process overall take?
It can vary. It depends on your past medical history. Have you had children before? There's a lot of variables we'll discuss in a moment, but it can take anywhere up to 24, 48, 72 hours, or even more sometimes.
What are the different factors of labor?
I summarize this in the 3 Ps. So there's the passenger, the pathway, and the power. So the passenger is the baby. So, if the baby's measuring larger, if your passenger may take a little bit more time. Pathway. So if you've had babies before, that pathway has sort of been carved out. Whereas if you haven't had babies before, there is this kind of tight road that the baby, almost like a corkscrew, has to navigate and work down. And then the last piece, which is really our specialty, is the power. And so, early stage labor, the hormones that are required to give birth, it's like a car going a little bit slow. And then the after stage of labor, the pushing stage of labor, this is when your car is on the freeway going 65 miles an hour. Lots of power is behind it.
So when does my support group and the laboring nurse get involved in the pathways?
All throughout. We're there from the very beginning to the very end. Some hospitals have the units combined where we're with you even in the postpartum period, but our particular hospital, we're with you just the brief postpartum period. After about 2 hours after delivery, we're with you, navigating through early stages of labor onto the active stage of labor, and then until baby comes out, and then we monitor you and baby for a little while afterwards. We're making sure that you are bleeding normally after delivery, whatever pain you may have, we're tolerating that okay. And then of course that your baby is transitioning safely and normally afterwards.
One clarification question I had. During my children's birth, my laboring nurse was with me the whole time.
Mm-hmm.
So do you see other patients?
We can have up to 2 laboring patients. When it is more of the active phase, it is time for you to deliver, then we're one-on-one. I'm with you the entire time. Our coworkers watches my other gal while I'm now primarily with you and your baby, and with you until after the delivery.
This pertains to your institution because depending on the availability, or even us, if we're short on staff, sometimes our nurses have to take care of more patients.
Yes.
So I will put an asterisk there. And the other thing I'll add to this is what's amazing is our nurses are primarily the one-on-one with the patients in and out of their room. We may be checking on the patients intermittently, and it's not uncommon for us to be rounding on other patients, to be performing other procedures, C-sections that come in. Sometimes we'll get ED consults. We may be in the operating room with a GYN patient. We are constantly looking at all our patients in collaboration with our nurses who have really that boots on the ground, one-on-one.
So they're like your eyes and ears.
Totally.
Something's going wrong.
Women have been laboring for thousands of years. Your bodies in general know how to do it. Sometimes we're here to just help remind it or nudge it along. But really what you're hiring me is for the emergencies, right? So when the pathway is becoming challenging for the baby, or the baby's not tolerating labor and it's not safe to continue on, I'm really here to deliver the baby safely or to deliver the mom out of a dangerous situation.
Okay, so if I am laboring, will I be on my back the entire time?
Ultimately, it just depends on what your plan for pain control is. Moms that choose to labor without epidurals have the freedom to walk around, stretch, be on the birthing balls, whatever they want. As long as we can maintain baby on the monitor and make sure baby's tolerating labor okay, you're good to do whatever you want to do. Moms that want the epidural do not have to stay on their backs the whole time. You have the freedom of sitting up all the way, being on either side. Once we get more active labor, we really like to incorporate use of the peanut ball and all sorts of different positions to help baby come down, mimicking that same activity that a mom without an epidural would be doing. So no, you're not limited to your back at all.
Does the time matter?
In other parts of the world where patients are laboring on their own for a really long time, they start to quickly inherit complications. So primarily infection and postpartum bleeding, but also long-term. It's not uncommon for parts of Africa for a woman who had been laboring for a long extended period of time to develop fistulas afterwards, because there's this constant pressure that causes the tissue to disintegrate essentially.
Oh, yeah.
So then they may develop issues with urination, defecation, and it's really problematic, right? So we have in the United States the ability to help you through the different stages at a good pace so that you're not inheriting these complications. We'll talk about this at the tail end, but there are different medications or different methods and positions that we will utilize to get you through this safely.
All right. So I'm at home and I started developing all the contractions. How do I know if I'm in labor or not? Or
I think the big thing with labor is pain. We like to see moms come in that are huffing and puffing, contractions anywhere from 2 to 5 minutes apart consistently for maybe 1 to 2 hours. But we like to know that they're painful. If they're pretty tolerable, you can kind of talk through them, you can do activities through them, then chances are they're probably not doing a whole lot of change to your cervix.
That's the most important thing to take away from, is that remember the stages of labor. You cannot go through those, or hardly ever do people go through those without strong, powerful contractions. So if you're not having strong, powerful contractions that are consistent and persistent and increasing in frequency, then it's probably Rex and Hicks or probably false labor.
so what are some of my pain coverage options during delivery?
This is a really broad topic, and what we'll do is we'll talk about it with one of our anesthesiologists in a different video, just for the sake of time. In general, you have IV pain relief. Some institutions offer pudendal nerve blocks, and then lastly, the epidural again, primarily.
You guys kind of mentioned induction. Can you clarify what that is?
Inductions is essentially your body going through the different stages of labor, but instead of waiting for your hormones to kick in for this process to happen naturally, we give you those hormones. So for example, you may hear your physician recommend Cytotec, Cervidil. Well, this is a prostaglandin analog, and this is causing the cervix to soften. And so this is something you may be recommended. Pitocin is another brand medication that you may be recommended to help you either with your labor or with an induction. Your body's producing this hormone. It's called oxytocin. And so when you're in labor naturally, this is a medication that really ramps up and helps you to push that kiddo down and out. And then other processes we can do, there's cervical Foley balls. There are a procedure called artificial membrane rupture, which is essentially copying what happens naturally with your water breaking. And so ultimately, which medication you're recommended has a lot of variation, because it depends on what your labor history is, where you are in terms of your cervical exam, how the baby looks on the monitor. There's so many different pieces to this puzzle that we don't have like a one size fit all for patients. It just really depends on the institution, on the physician, and on the patient.
And can you summarize the top reasons why you would recommend an induction?
Depends on the baby's health and also the mom's health. So sometimes patients will have medical issues like diabetes, high blood pressure. Sometimes they develop high blood pressures in pregnancy. This is called preeclampsia. With regards to the baby, sometimes the babies are measuring smaller, measuring larger. Sometimes having monitoring done outpatient, the babies are showing already signs of distress. So there's various reasons why A physician may recommend that we go ahead and start the labor process early so that we can meet your kiddos safely and not start again inheriting potential risks of staying pregnant or continuing pregnancy.
All right. Well, thank you so much for that information. I learned a lot. What is the ultimate take-home message?
All moms should know that when they come into labor and delivery, they are going to be supported by their labor and delivery nurse and the whole OB team. Whatever they want for their birth plan is going to be carried out as much as possible. And we're going to be there for you every step of the way.
Thank you again for joining us for another episode of Sisters RX,
where we prescribe clarity in a world of medical noise.
Until next time.
Cheers!